here's a reminder, smoking is bad for you. Tobacco kills up to half of its users, nearly 6 million people each year. This is a statistic according to the World Health Organization.
Yet despite that number, the number of smokers worldwide stands at a staggering 1.1 billion, and they run the risk of a lot of illnesses like respiratory diseases and coronary heart disease. So to tell us more this morning is Dr. Dinesh Nair. He's a cardiologist from Mount Elizabeth Hospital. Doctor, thank you very much for joining us today.
Morning. Thank you for having me.
All right, so how does smoking increase the risk of coronary heart disease?
Well, first of all, there are many risk factors for coronary artery disease, or for heart disease, if you will. We've all heard about them at multiple points in our time. High cholesterol, high blood pressure, genetic factors, diabetes, stress, but smoking is the biggest one of them all. And smoking is the one that is the most reversible, because a lot of these other things require treatment with medication, etc. But all you need to do with smoking is actually stop.
So once you start smoking, the risk of many diseases goes down?
Yes.
How quickly? So
by 10 to 20% overall, smoking actually affects not only the heart, it affects the lungs, it affects the kidneys, it affects all the tissues. And the reason for that is tobacco smoke, and any other kind of smoke as well, has over 4,000 harmful chemicals and toxins. The most significant of them all is nicotine, and nicotine is what causes the addiction. So when people light up, they keep needing that nicotine high. The smoke and the nicotine and all the chemicals actually affect the arteries that supply the blood to the peripheries, to your brain, etc. And your heart's like this, like the size of your fist, a little bit bigger than your fist, and it pumps blood all the way around. There are vessels coming out of it that go up towards the head, that go down towards the legs, and the nicotine in the smoke, in the cigarettes, actually narrows the arteries. The other substances, in addition to the nicotine, actually cause hardening of the arteries. And so what happens is the smoke doesn't increase your cholesterol, it increases the likelihood that cholesterol plaque can stick to the inside of the arteries.
So we have some visuals there. We have a heart, we have an artery that looks quite clear, and we have one that has atherosclerosis.
Atherosclerosis.
That's what it's called?
That's collection of cholesterol on the inside of the arteries. So if you've got a stiff artery, the cholesterol plaque sticks to the inside a lot easier. Now, we've mentioned high cholesterol as being one of the risk factors for heart disease. We all have some degree of high cholesterol. It's how high we are on that scale. If you were to measure our cholesterol against other mammals, such as orangutans, which are closest to us, their cholesterols are like 1/3 of ours for the bad cholesterol, or the LDL. Now, when you add smoking on top of it, what it does is it compounds the whole thing. So the risk factors add on to each other, and in multiples.
Okay. Doctor, for a person who's been smoking for like a decade, let's say, and stops because of all these health concerns, can the damage be reversed?
Yes, the damage can be reversed. Studies have shown that if you quit by the age of 40, and there's several studies that have been published, if you quit by the age of 40, you can reduce your risk 90%. You don't get back to your baseline normal, but you come back towards that normal. So if you watched yourself and you looked at a scale of 1 to 10, if you're at a 9, you can drop that down to a 1 or a 2 for some people. The longer you're smoking, the worse it is.
So, okay, you mentioned 40 there, but is there a stage where it's too late?
There's never a stage where it's too late. We have people coming in with heart attacks in their 60s, 70s. Those who continue smoking, when we fix the arteries, they get problems again. But those who stop, we can manage it with medical therapy. So it's never too late to quit, even if you're 90.
Okay, what about secondhand smoke then?
So we always think that secondhand smoke is less harmful. It is to some degree, and once again, if you go on a scale of 1 to 10, from a 9 you drop it down to an 8 or a 7, it is still very significant. Secondhand smoke, you inhale that smoke anyway. It's the same thing that people say about tobacco smoking from cigarettes. When you cigarettes and cigars, if you smoke a cigar, most of the cigar smokers don't inhale, but that smoke lies about, and afterwards they inhale it thereafter again. So all that smoke goes in. It's slightly less harmful, but only slightly. Secondhand smoke, cigar smoke, all the other stuff that we get.
So how much exposure to secondhand smoke does a person need to be exposed to before it becomes harmful?
I think any amount of exposure is harmful, especially to young children. Babies, etc., are most susceptible to lung problems, etc. The more it is, the worse the effect. And it compounds itself in multiples once again.
Okay. Studies also show that smokers have a 30% higher chance of kidney failure. Why is this?
So I had mentioned earlier on that smoking affects all the organs, down to the legs, etc. You get blockages in your leg arteries. If you know, it's like the pipes in your house. Okay, if you've got gunk in one area, you tend to have it in other areas as well. So if you've got blockages in the heart arteries, you tend to get them in your legs. You can get them in your kidney arteries as well, by the same token. And when you smoke, you reduce the amount of oxygen that goes to all the tissues, all the organs in the body. And when you reduce the amount of oxygen, that tissue becomes less efficient in functioning. And therefore, there's an increased risk of malfunctioning of that tissue. The kidneys are very susceptible to all kinds of insults, especially lack of oxygen.
Okay, for smokers who are watching us now and knowing everything that you talked about, how can we make them stop, though? Why is it so hard to make hardcore smokers just stop?
I think the difficulty is a lot of the time in the visuals. People like the whole idea of the cigarette being lit up. There is the addictive factor as well. Nicotine is one of the most addictive drugs around. It's actually considered more addictive than some of the other drugs that we know about. At the end of the day, it is also a social thing. A lot of smokers tend to associate with other smokers. So it's very difficult to quit. But having said that, help is out there. The Health Promotion Board has got an excellent website with all kinds of tips. There's a 28-day quit program that you can look it up. I was actually very impressed when I looked at it. And there's all kinds of help that's available. They give you SMSs, etc. So you can actually help yourself to quit that way. Why is it so difficult? It's all in the mind. If you really want to quit, you can.
Okay. Just for the sake of our viewers out there who would be asking this, if governments around the world can declare drugs illegal, why can't cigarettes with nicotine, which is addictive, be declared illegal?
I think if you want to draw parallels, it's the same thing that you can draw with alcohol as well. We have a lot of problems associated with alcohol. You can't ban the alcohol. This has already been out there for so long. That is why governments have difficulty in banning substances such as nicotine. But what they can do is ban new substances coming in, new ways that tobacco can be brought in as well.
For example, e-cigarettes.
E-cigarettes. E-cigarettes, there's no tobacco in it, but there's nicotine. And what you have is nicotine being spread out to a young population. In the US, where they've used e-cigarettes, there's a whole crowd of people now who are addicted to e-cigarettes. This is why e-cigarettes were not brought into Singapore. And it makes sense, because you've learned from the American example.
All right. Okay, for the sake of those who want to quit then, doctor, how do they start and what is the best way to do it?
Okay. So I've mentioned earlier the Health Promotion Board has got an excellent website. There's a lot of self-help tips on that website that you can look at. The main thing you need to know or need to do is you need to want to quit to start with. Everyone knows the harmful effects. You need to want to do it. You set a date 2 weeks from now perhaps. Try and cut down the number of cigarettes you're smoking up till that point so that the amount of withdrawal you get is less. And then it's a matter of going cold turkey at a point where you've cut your cigarettes down. That is the best way that we've used for a lot of our patients, and it works. Some of our patients have found help with self-help groups, with hypnotherapists, with counselors, with acupuncture. Why not? Whatever helps.
All right. Thank you very much, doctor. And I hope your advice is useful for those of you out there who have decided you want to quit. If you're going to quit, take the first step and stick to it.
And quit now before it's too late. Dr. Dinesh, thank you very much.
You so much.
Dr. Dinesh Nair from Mount Elizabeth Hospital.